I'm here with Dr. Tomas Bjerner from Uppsala, Sweden.
Yes, nice
Welcome.
to meet you. Thank you.
It's great to have you here on the Carestream booth. It's been another exciting year in RSNA 2013, which is about the power of partnerships. We'd love to get your thoughts and perspective as to what are some of the key trends you see in RSNA, as well as the key technology innovations that you see.
I think one of the big things that we need to address is the increasing load of images, and not only images but also the information that's in them. You see the complexity, a lot of things need to be fixed when you work with MR, and it sort of takes time and it's cumbersome and there's some resistance to work with it, and people thought CT was easy. And now you see the trend in CT and other modalities to become more complicated. And I think one big trend that you see is that we get more functional images and functional information in the studies that we do, and how to cope with that in reports and in other situations is something I think is important to address. We see the same like on the internet. You have a lot of information on the internet, but if you don't get the right information, it's not so useful whether it's there. You need to have the right information to make your diagnosis. I think that is an important trend to solve.
Yeah, I mean, as with most things, we have a lot of information. It's a processing information, making it useful. And we talk a lot about knowing matters at our healthcare IT. Do you see any solutions or any providers that are slightly ahead of the curve in terms of helping radiologists and IT professionals solve these problems?
I mean, there are different ways. I mean, you have different layers. First, you have the modality part where you actually look at how you acquire the images, how easy it is to acquire images that otherwise might be tricky to solve. That is one trend you see that some vendors sort of fix on that side. Then you can see that you work with different sort of the platform, how you look at the images are also changing in terms of where you work with them. Are you sitting with a modality, or are you sitting more loosely? How do you work with that in your complete workflow? And then of course you have some vendors actually looking at how you structure your report, how you actually can retrieve information from your report so that you somehow work with the workflow in all steps. And every step is somewhat complicated, and I mean, it's a lot of information to grasp.
Sounds like there's a lot of opportunity in terms of how we structure information, how we process it, etc.
And I think that if you are successful in finding ways to sort this out, because information is there, there is a lot of ways to fix the information and find information, or sorry, not find information, but to acquire the information, but to structure it. I think there's a big opportunity here.
And to make it meaningful.
Exactly.
Yeah. Well, thank you so much for your insights.
Thank you.
Thank you.